Hello and good morning. All right, my name is Frank Kalidemudia and you welcome to Clevenard.com. Clevenard.com is an online social networking marketing company just with a vision to sell Africans to the diaspora. In other words, we just create awareness within and for the community. All right, this morning we are in the office of Dr. Vetty Agala, and we will be discussing health issues in Rivers State, Nigeria. Right. There is a maxim that health is wealth. And for every human being on planet Earth, the most important thing is the health of every individual. And when you have a government that is instrumental to making this a reality in the life of these people, it becomes very much interesting. And this morning we are with Dr. Vetty Agala, who is the acting secretary River State Contributory Health Protection Program in River State in Nigeria. So thank you, welcome to Clevenard.com.
Thank you. Happy to be here.
All right, we'll start with this. Who is Dr. Vetty Agala?
Dr. Vetty Agala is a health enthusiast, a community advocate, a lover of people, and a service-oriented person. I am a public health physician um, working with the River State government, but my interest is that one person out there, that one woman, that one child out there who I want to see live their full potential. And so I'm a reproductive health advocate, a lot of advocate of so many things, universal health coverage and all that. So that's me in a nutshell. I'm a mother, a daughter, a wife, sister, and so many things to so many people. So that's who I am.
Yeah. Thanks so much for that. We are in the business of creating awareness within communities. And then when Cleveland says communities, we don't just make communities as where we come from. We make communities of different professionals as well. So we are here talking about communities of health. All right, now let's take a brief look at the health sector in River State. How would you appraise what have been done so far?
All right, thank you very much. One of the things I didn't mention, of course, is your introduction that I am the acting executive secretary of the River State Contributory Health Protection Program. And so if I'm to speak about the River State health sector, having worked in this sector for the past 18 years or thereabout, I can boldly say that for us as a state, the Ministry of Health guides all that the MDAs and the parastatals under the Ministry of Health does to ensure that everyone that lives and works in River State is healthy, because as a government, a healthy workforce is important for the economy and the productivity of the state. And so the health sector in River State, of course, is led by the Honorable Commissioner for Health, Dr. Adeze Chidema Ore, a very hardworking, strategic leader that we have in the health sector currently, who is moving the agenda or the health agenda of the government of Sir Signalai Fubara forward. The health agenda is health for all rivers. And so the idea is to ensure that everyone that lives and works in River State can have access to basic healthcare that they need, good quality, effective healthcare without going through financial hardship. And so she is being able to galvanize all of the departments in the ministry, all of the parastatals of the ministry, to ensure that all the health systems building blocks are taken care of as a government. And so when it comes to leadership and governance, she's showing us strategic leadership. She's innovative. She's advancing everything that we've had before. And we are seeing so many strides. And of course, that culminates in us winning certain awards at the national level and at the zonal level. And so the government is ensuring that we have infrastructure. So we have good leadership. The institutions, whether it's tertiary institutions, secondary, primary, are headed by people who we have bought into the vision and the mission of the government and are leading the efforts in those areas and those thematic areas that put together the health of the people. And so leadership and governance is in place because she's placing the right people in the right places. And of course, when it comes to health infrastructure, the government of the day is ensuring that across all levels, the primary healthcare, the secondary healthcare, and the tertiary levels, our facilities are being refurbished, renovated, re-equipped, and aside from that, we have our zonal level hospitals that are also being built to ensure that at various levels people can access healthcare, without going through so much stress. When it comes to human resource, you recall that for over 12, 14 years, I don't think that employment had really been done. And so the governor has also ensured that the health sector gets new employees across board, doctors, nurses, lab sciences, everyone, because you could have infrastructure, but if you don't have the human resource, then of course you can't really get health services done. And so government is ensuring that they are also going ahead to ensure that there are equipment, that there are drugs, there are consumables. Recently, the governor just paid for family planning drugs and consumables, and that's something that hasn't happened in a long time. We just recently received those. The drug management agency, what we call our central medical stores here, is very functional, and we can get quality drugs from there. So everything at the level of the ministry, the commissioner is coordinating. We have the Emergency Operations Center, the Public Health Emergency Operations Center, which is there to ensure that we can combat every epidemic, pandemic. You know the story of COVID and how the state was able to pull through that. So public health, maternal and child health, all of that is being coordinated at the level of the Ministry of Health. And so you get down to the MDAs. We have tertiary institutions. Our teaching hospital just got accredited to train people in over 20 subspecialties of medicine. And that's amazing, because then we can generate revenue, we can increase manpower, and all of that. Of course, we have the medical school, which continues to churn out doctors, nurses, and all of that. And then this government of the day also supports the Palmer University. So we have a lot of health workforce being produced on a yearly basis, and that helps the entire system, and also to curb the issues of Japa syndrome and a couple of other issues. It might interest you to know that the government of the day has also, amongst others, I mean, the health workforce is part of the entire workforce of the state that have been promoted. Who had, I mean, in the last 12 years, there was no promotion. And you know how that affects the way that people work. The welfare of the people is so important, So incentivizing people, ensuring that they get what is due them, helps them to do their work better. So I must say that for us, the health system is moving in the right direction. So we have leadership, governance, we have the health facilities, equipped human resource, and all of that. But yes, some people cannot pay for these services because health is not cheap. Health is wealth, and health is not cheap anywhere in the world, not even here. So for the government of the day to also, in this year, to approve the implementation of the River State Contributory Health Protection Program, that's like the icing to the cake, because then people can actually access the facilities that government has put in place without really breaking the bank.
We'll go over to that question. Actually, this question.
All right.
But let me ask something. You've been talking about the system providing for the people
Yeah.
in the states.
Yeah.
All right. And then you still have so many people thinking that because they are not from River State, they don't really get access. Again, access to these healthcare initiatives and the rest of them. So what you're saying now, are you saying that there is inclusiveness in this sector?
Absolutely.
River State is a very friendly, hospitable, and welcoming state. And so there's nothing we do that we exclude whether our guests or people that live and work here.
in the state.
So when it comes to health, we are open to having people who are non-indigent be part of our healthcare system. It might interest you to know that even some of our employees, the government employees, they are non-rivers. We have non-rivers people occupying strategic positions in the ministry, in the government. And so, even in access to healthcare, we are able to include everyone. And it's not just based on tribe or where you're from. Whether you are rich or poor, there's always something for you. There's a way you can access healthcare. Whether you are old or young, whether you have disability or different abilities. And so we have a very inclusive government. And so what the Ministry of Health actually tries to do is to provide that leadership and strategic direction such that every MDA is able to function to ensure that every facet of the community, whether at the primary, secondary, or tertiary level, whether at the different disease areas, maternal health, child health, HIV/AIDS, epidemiology, and all of that. So the ministry guides the government, gives the government, how will I put it now? We kind of provide direction. I mean, the governor cannot be both doctor, lawyer, everything. Exactly. And so every ministry has the technical know-how to be able to guide the government in the direction that they want to go. And so formulation of policies, advising the governor on health matters, developing and domesticating laws from the Federal Ministry of Health, for instance, and bringing it here, adopting and adapting those kinds of laws, supervising programs, projects, and all of that. Just ensuring that everything health comes together. Because when we talk about the health system, it's about everything, human beings, structures, everything that comes together to bring about good health for people. And so that's, in a nutshell, is what the ministry does, and that's the direction the health sector is going, and it is an all-inclusive sector, ably led by the Honorable Commissioner.
That's a good one. A few days back, at least, you took us right from Garrison down to Water Lines in, and we went around the entire Port Harcourt. Actually, I was part of that section. I went back to my house looking tired and all that, but it worked, it helped, and it was very nice. Now, we want to talk about the River State Contributory Health Protection Program. I think it was the organizer of that event I just described. What is it all about? What is the mandate, objectives, the vision?
Absolutely. So you recall that in talking about the health sector, I did mention that one of the strategic decisions that this government took was to approve the implementation of the River State Contributory Health Protection Program. Now, RIFCHIP, as we are popularly known, is the health insurance agency of this River State government. And so, our mandate is to ensure that everyone that lives and works in River State can access the health care that they need of sufficient quality to be effective without going through financial hardship, regardless of who they are. And this healthcare could be promotive healthcare, it could be preventive healthcare, it could be curative healthcare, rehabilitative. So we're looking at the entire spectrum of healthcare. We're saying that people that live and work in River State should have access to basic healthcare when they need it. And so our mandate is to ensure that people get health based on need, not based on ability to pay, based on need. And so when we came on board, of course, we have a vision for ourselves. In carrying out that mandate, we decided, okay, so where do we want to see ourselves in 10 years, in 20 years? And we thought that we wanted to see a health insurance agency that will be providing quality health care to our people. providing quality healthcare. So we want to be the best. Remember that Rivers State is one of the last states to start implementing their health insurance agency. It might interest you to know that our law was signed as far back as 2021, and it was not implemented. It was in the shelf until January 2024 when His Excellency approved its implementation. So our vision is to be the best. We like to say the premier health insurance provider in Nigeria, and not just in Nigeria, maybe in Africa, providing that financial risk protection for all Rivers people. And that's our vision, to see where anyone can be part of RIFCHI and access healthcare without really selling a property, to meet their medical needs. So that for us is our vision. Now, to help us to get to that vision, we have a set of core values that fit into our mission, because our mission is how do we get to do that. So we want to provide this financial risk protection to all of Rivers people, doing that in an accountable way. Accountability is something that for us is key, because we have a governor who, in his 1 year in office, sat everybody down and said, this is how much came to Rivers State, this is how we spent it, this is where we are, this is where we are. So we don't want to do anything outside of that. So for us, accountability is so important, and we want to provide this financial risk protection with accountability. We want to ensure that we are people-centered. So in everything we do, we prioritize our enrollee. We are careful to know what their feedback is when they go to access our healthcare facilities. We are careful to know that we are timely in our intervention. So we put together our mission to say that we want to provide financial risk protection for all people that live in Rivers State through accountable resource mobilization. Because we're going to be mobilizing resources, whether government is paying, whether people are paying, or we want to be accountable. We want to pull together risks, we want to pull funds together, and be able to strategically purchase these health services. When later we talk about some of the plans we have, you will find that they are ridiculously cheap. And so you wonder, how do we want to cope with that? But that's because we want to be accountable in our mobilizing these resources, pull funds and risks together, and then purchase strategically, because wholesale is always cheaper than retail purchase, And in so doing that, we prioritize our clients, ensure that they get the highest quality in the most efficient, equitable, and excellent manner. So, those are the guiding principles for us. And so we have an acronym acquired that speaks to our core values. So you talk about accountability, you talk about quality, you talk about client-centeredness, you talk about equitable, service provision, excellence, and all of that. So those are the things guiding us in our day-to-day work, to ensure that everyone that lives and works in Rivers State can access the healthcare that they need of good quality. And why we're particular about this is because so many times people don't trust services that government provide. You know that on a normal day, 60% of healthcare is being provided by private or non-government facilities. People just think that if it is government, then something is wrong with it. And that is an impression that we are trying to change, to build confidence in the people, to get them to trust this government to give them the kind of quality care that they need.
It's all right. You are so passionate about it, because a few days back, I will refer us back to that. Few days back again, I saw the way every one of you came out. Even the Commissioner for Health was there as well, where we went on the health work. Why the motivation? Why are you so concerned about it, people? and even to the extent of taking care of the poor and the less privileged in the society.
So when I started, you asked me, who am I?
Exactly.
So for me as an individual, I am someone that cares about the welfare. And I think that most doctors and healthcare providers are are led by the need to see that people are healthy. And so all of that background, plus we have, like I said, we have a commissioner that is committed also to people. So this is not just about me, it's about the entire people, the rank and file. The governor is concerned about Rivers people, and so his mantra is Rivers first. It means that the people of Rivers State matter. The commissioner, we are talking about health for all rivers. And then us, we at Reef Chief, we are concerned with people just smiling and saying thank you. God bless Governor Siminalayi Fubara, just because they had a CS that ordinarily they would not be able to pay for, but the government of Rivers State has made it easy for them just by being part of a scheme to have that done. Just yesterday, I got feedback from some people, just seeing the joy on the faces of people and having them worry about other things, maybe not health, because if you run a business and you have a health issue, you will use your business money to pay for that, and that can run down the business. I was seeing that happen over and over again. What the government of the day is saying is that, see, we're going to help you with your health alongside other things, because I know that the government has given loans to small, medium scale, farmers and other entrepreneurs. So, but if they give you loan and you start, and then a health issue comes in the family, and then you have to use the fund, then what happens to you? You're back to square one. So, what the government is trying to do is to layer all these interventions and safety nets for the people. That way they can focus on being more productive. And it's all better for our economy.
Better for the economy. I would like to say one or two things there. We are still on Clevenard.com. It is an online social media platform with just the vision to sell Nigeria to the diaspora. Everything good about Nigeria. Talents, agricultural products, the health sector, anything that has to do with promoting the economy of this nation. It is our responsibility to make sure we come together and make it a success for each and every one of us. Because, like we always tell everyone, there is no place like the one you got, because that place is the only one that belongs to you. We must build Nigeria. Rivers State must be great. Nigeria must be great. All right, we are still on the discussion, Dr. Vetty. I know you've said one or two things about the health insurance, but I still want you to discuss the concepts of the social health insurance in Rivers State.
All right. So the concept of social health insurance, not just in Rivers State, but across the globe, it's a concept that is not profit driven. It's a concept where contributions are made by governments, by individuals. Everybody pulls resources together, and then, like I said again, we strategically purchase health services. So the idea is, if all of us in this room now are part of a scheme, it's unlikely that all of us will be healed at the same time. And we are used to these kinds of things. We've done Osusu. I mean, you may not be a market woman, but even as a civil servant that I am, we've had to do contributions. So everybody brings an amount of money, and people are able to carry out projects month after month that on their own they may not have been able to save up, without having an interest to pay, or you know what I mean. So the concept of social health insurance is a solidarity concept. It's something that everybody contributes. The rich contribute more. Those that have less contribute less. And those that do not have at all, they are part of the scheme and they benefit. That for me is the entire concept of social health insurance. And that's what we are practicing even as a country. Now recall that the National Health Insurance Authority now started out as National Health Insurance Scheme. And when it started, it was a concept where at that time it was voluntary, so only few people were in the scheme. And that's why over the years, we couldn't get the kind of progress that we needed to get. But with all of the reforms, now health insurance is mandatory. It is tending towards everyone being in that pool. And so once everyone is there, if you're a civil servant, you get to pay based on your earning. So you're paying a percentage, if it's 1%, 2%, whatever. And so if we all pay 1%, it means that the level 5 officer pays 1% of their earning. So that's equity. And so everybody comes together, but those who are ill are those that benefit. So I know that some people will say, oh, why do I have to contribute when I don't fall ill? But in the concept of social health insurance is a solidarity thing. It's something that we all put together so that those who cannot on their own pay for some big bills are covered because they are part of this thing. So that's the concept of social health insurance. We pull together contributions, funds, and we pull risks together. And so in our social health insurance, we do not do a risk-based assessment. It's a needs-based assessment. Because if you look at what the HMOs do, you have to fill a form. They have to know whether you have a disease prior. Are you hypertensive? Are you diabetic? Because all of that will impact on the premium that you pay, right? They have to check how old are you? Do you drink or smoke? Because all of these things are likely to make you more susceptible to certain illnesses or the other. How old are you? Because the older you are, the more likely to have. So, but for a social health insurance, our thoughts is not so much of who can pay, who cannot pay, who has this problem. It's about everybody coming under that safety net. It's about, ensuring that those at the greatest need access the care. Because when they talk about the indices of a state of the country, they look at maternal mortality. They look at infant mortality. They are not looking at, maternal mortality in the rich. Maternal mortality. No, they don't look at those. So these services are the basics, and those are the ones that are mostly covered. And you know that those are the lower end of the ladder. They are the ones that become more ill, have more children, having all of that. So if you leave them to tend to their health alone, then we'll continue to have a problem.
That's right. Let's say for the interest of the audience now, I'd like to rephrase that question. I think I've asked it and you said one or two things about it earlier. All right. Now, what does it take to be a beneficiary? Because most people might come up and I was sick and I wasn't taken care of. And I have to do one or two things, and at the end of the day, what I contributed, I didn't get anything from it. Even for those that didn't even make any contribution, they can still have complaint. We are in Nigeria, we know that. Now, to be a beneficiary, what does it entail?
All right, so to answer that question, I'll start by letting us know the different plans that we have. Because your benefits is based on, or your benefits and your eligibility is based on the different plans that we have. Okay. So the first plan that we have, which we have been implementing so far, is the Basic Healthcare Provision Fund. Now, that Basic Healthcare Provision Fund is a fallout from the federal government and the state government. Remember, government is interested in the people of Nigeria. Not just a River State thing, it's a Nigeria thing, and the state governments have shown commitment by also adding to that pool. So as a country in 2014, the National Health Act made provision for 1% of the consolidated revenue fund of this country to be put into a basket with funds from partners and other philanthropists and whatever. Now that fund is now divided into gateways. We have the health insurance gateway, which I'll focus on, but we also have the primary healthcare gateway, because we understand that people are in communities and primary healthcare is the closest to the community. So you want to strengthen the primary healthcare, because that's the first port of entry where people go to access healthcare. So strengthen the primary healthcare, strengthen the emergency medical services, because yes, and that's one of the functions that the ministry, is carrying out. We have ambulances around, So strengthening that system to ensure that if a woman is ill or is in labor or a man has a heart attack, whatever it is, that you can call the ambulance toll-free numbers and they come and pick that person and take the person to the designated accredited health facilities. So it's 4 gateways, but we run the health insurance gateway. And so people who are registered under the Basic Healthcare Provision Fund are able to access a minimum benefit package of health services. And that includes maternal and child health services, non-communicable diseases, communicable diseases. It's a very robust package. I believe maybe if we want to be specific later, we can talk about it. So those set of people are Nigerians who are poor, who are vulnerable. For us in River State, we have categorized them to children under 5, adults over 60, persons living with disability, pregnant women, widows, some chronically ill persons, because we've had some advocacy visits to us to say this set of people, yes, we are taking care of their HIV drugs, we are taking care of their this or that, but when they are ill with other problems, they are unable to pay. So we have captured those, as many as we can. All right? So those sets of people who are chronically ill, sickle cell disease, and then widows, especially the poor and vulnerable widows in the communities. We have also, as a state here, captured all the people that are in our safe home, people that have had gender-based violence, issues. They are in the safe home. People in the children's home, in the remand home. All of the government safe homes. We have covered them. Those set of people don't have to pay a dime. Government at the federal and the state level have taken care of those. So if you are under that scheme, you will not pay anything. And if you are under that, for you to be under the scheme, you have to be in any of these categories of people that I have listed. Now, there are people who are small, they are not poor, I won't call them poor, they are doing something. They are not working for government, they are doing their own business, like the bole seller there that, was enrolled into care,
and most of the people in the grassroots.
So, yes, you are in the grassroots, yes, you are in the lower socioeconomic level, but you are not eligible for the Basic Healthcare Provision Fund. That's where Simjara comes in. And Simjara is 15,000 naira, is an affordable package for our people. We also have what we call the equity plan. Equity plan is the same as our Basic Healthcare Provision Fund plan. But the thing is, you are not paying for yourself. The philanthropist is paying for you. Government decides, we are going to pay for this set of people, or whoever. You have a birthday, you decide to pay for 1,000 persons instead of doing a bash, and people just eating and going. But you have 15,000, and with about 15 million, you can reach as many as 1,000 people accessing healthcare for a whole year. So that's another plan. And then we have other plans that are corporate plans. So you are in the informal sector, but you're a bit corporate. You're not working for government. You have your own small company. There are 5 staff to any number and above. You are entitled or you are eligible for a corporate plan. A corporate plan can be a basic plan, it can be a premium plan or a premium plus. And all of those have different cost range for you to be able to get for your company people and cover them, all your employees in that scheme. And then, of course, we have the formal sector plan. So if you are a civil servant, both at the state and the LG level, then you have the civil servant formal sector plan, and then you are eligible for that. So eligibility is based on your category, and that fits you into a particular plan or the other. Now, for each of these plans, everyone that's eligible has something to show what they are eligible for. has their responsibility, tells you what is covered, what is not covered. So most of our exclusions are cancer treatments, because all of our plans contain cancer screening, prevention, and all of that. But once it is full blown, then we can't, our funds can't carry, because cancer care is quite expensive. And any aesthetic thing you want to do, or you want to put on braces, or you want to put a gold teeth and all of that, of course, we will not fund anybody's fantasies. Okay, so those are not there. And then, depending on the plan you're on, if you're on Sinjara, for instance, it's 15,000 a year, but you would have to do what we call a co-payment for your drugs. So yes, you can have any surgery, but the medication, you will have to pay a percentage of those drugs. That's the only way we can cope with the cost of care. So if you go to hospital and your bill is 10,000 for your drugs, you're not paying for consultation, you're not paying for any other thing, test, whatever, but your drugs. So if your drugs cost you 10,000, you would have to make a contribution of 1,500 naira. And so those terms and conditions, we tell our clients, depending on what plan that you're buying into, so that you know from the get-go and understand how it works. Now, also, if you are on the Sinjara plan, is a plan that you begin to assess care 60 days after your enrollment, because it takes us a bit of time to ensure that you have your cards, you get to choose your health facility, so your name and your details has to go to that facility. You have to be planned for from the beginning of a month, not at any point in time, so that they prepare that someone could come in today and they have your capitation for that month before you start assessing it. So that's how it works, and that's the eligibility for different plans. So if you look at what I've said, it means that everyone can fit into a plan.
That's okay. That's fine. You've said all the next question, all about the next question I want to ask, but I'll still need you to talk about something. The Sinjara scheme. You understand? From your explanation, it has to do with the grassroots. They benefit more from this plan, right?
Yeah, absolutely.
Can you just link it? Let them get to here, brother. We have so many of them, because basically part of what we do is to take the camera to the grassroots and then bring them up to places where they might not have been able to reach. Now, these people, most of them discover that at times they don't even know what is going on in the town. They feel excluded from so many things that goes on in the cities and in systems like this. I just wanted to link the two, the Sinjara concept with the grassroots development.
All right. So Sinjara, as the name implies, is a healthcare initiative of this government, of the government of Sir Siminalayi Fubara. It's a concept where all you're doing is just to show commitment, because really we've run free medical care program in River State for 10-15 years, from 2000 to about 2015, and I have been privileged to be in that system, because that's how I came up with the health insurance proposal and why we're here. So we know how people relate with things that are free. We know how people look at. People think that because it's free, then it's not good enough. Because it's cheap, then it's not good enough. So it's just a way of someone contributing. Because why did the free medical not stand the test of time? Why was it not sustainable? It's because only government was contributing. And so when government had challenges with funding coming in and were not able to fund, then it collapsed. So Sinjara is both a sustainability plan and an affordable, accessible healthcare plan for those in the grassroots. So if you live and work in River State and you haven't heard about Sinjara, just hear it now and hear it again, because it provides for you all the essential basic healthcare that you need as a person. Now, the things that are killing people.
Does it cover the farmers, the market
absolutely.
Women?
Farmers, market women, or you can come as a cooperative, as a group. You can come as an association. All right. We are already talking with different groups, farmers association, road transport workers, and all of that. And so you can buy in. In fact, the way we are going about it, you may be able to pay in tranches, not paying the 15,000 all at once. Once we know that we're working with a credible organization, we have documents signed, and we are able to get your money either monthly or in whatever way we discuss with the leadership of those organizations, then you're able to access healthcare. And in fact, there's a top up that we like to say that if you have the corporate plan, you have Sinjara as top up for your family members. So you can buy a corporate plan for all your employees, and then you get top ups for their dependents as Sinjara. And so 15,000, you can get a plan for your wife, your children, each. Absolutely. And as we look into next year, we're looking at tertiary institutions health insurance program to ensure that all the tertiary institutions in the River State, when children or students go to school, they are able to have a health insurance coverage throughout that session in the school premises. So anytime they're in school, they're able to access that. And so those we are going to keep pushing for, talking with school authority and ensuring that can come on board. So we are looking forward to that next year.
That's all right. Thank you so much, Doctor. And I'm going to take my last question. Not last question, but close to the last question. All right.
Okay.
You know, if you are in Nigeria, you discover that part of the problem we have in this country is having too much capital flights. Things, money going out, and we don't have enough to come in to boost the economy. All right. And from what you said so far, it's actually a way of helping or building the health economic sector in the country. All right. Now, let's take a look at the potential health tourism destination. All right. Now, do you think Nigeria we are where we are in terms of health in being able to achieve that? Knowing fully well that we have professionals, people that really knows what they are doing in the sector, can we really attain that? Is it possible?
In my dictionary, impossible is not that.
Everything is possible.
Everything is possible. Everything depends on our commitment. And,
exactly.
I can make bold to say that the health sector of the country, led by the Honorable Coordinating Minister for Health, Professor Ali Pate, is leading strategically to ensure that Nigeria can gain back I want to say it's lost glory. But that's as a country. I would be able to speak of River State because I'm here, I live here, and I work here. And from some of the things I talked about earlier, our healthcare facilities, the government is ensuring that there are places where you can go and feel comfortable to sit and get quality healthcare. If you look at our teaching hospital, the River State University Teaching Hospital, I don't know whether you've been there before. I think you should take a tour there, take a visit. It is acclaimed as one of the best on this side of the Sahara. It is one of the cleanest hospitals that I have been to, and I've been to quite a number of hospitals in and outside of the country. And the fact that we are expanding to provide specialized care. So some of the things that people used to travel for, they are here. So what is medical tourism? It's about going out there to get your needed health care.
Exactly.
Because perhaps you can't get that here. But the state government is setting up infrastructure, training people to ensure that we have the right human capital to deal with every possible challenge or the common things that take our people out. Of course, we are not doing this alone. We are partnering also with the private sector. Because remember that government cannot carry on this alone. And so there's a lot of partnership from private sector. There is a lot of support from the international community, international partners, and all of that. We have some of our people in diaspora that are coming to look in and to to support. I will keep talking about the Rivers State University Teaching Hospital because we have a lot of exchange programs coming up. So you have our people out there come here to carry out certain surgeries.
Wow.
Two things are happening. They are providing that service and they are training the people that are here. So I look at Rivers State as one of the states that is very, very quickly going to be a destination for medical tourism in Nigeria.
If you can really actualize that, that would be great.
Also, and of
And
course,
it
if
brings
we
it to
raise our
Nigeria.
revenue, it will,
Exactly.
a lot is happening. And I'm sure you know that as a state, our IGR is going up, and that's because we are strengthening
Even as a country,
infrastructure, we are strengthening systems to ensure that we can retain what we know here. So I think that River State is looking forward to becoming a medical tourism destination.
It's all right, that's good. And then we just pray that at least every state imbibe this concept. We all really need to build Nigeria. It is our country, it is the only place we can actually call our own. All right, let's take a final word. I would like you to leave the audience, our target audience, with final words.
My final words would be to say that Rivers First, Health for All Rivers, River State being a medical tourism destination is not just work of the government. Government, yes, we have the vision we want to be, and the direction, the commitment is there, but we need people. So we will continue to leverage partnerships from private sector, from CSO, civil society. They are always there to help us to maintain the right direction because they also look out for the people just the way we look out for people. And so we believe that with what the government of the day has put in place, people need to access it. So we have a health insurance program. We have primary health centers. We have, and by the way, we are not only working with government facilities, we work also with private facilities. So we have all of these. We need you to trust us, to assess this care, to buy into this plan, to take care of yourself. Because sometimes, like I tell people, we can pay your hospital bills, but we can't carry the pain. We can't carry all the intangible costs that comes with it. So we are interested in you being healthy. We are interested in you being productive. So as a government, I want to believe that we will continue to sustain investment. We will continue to come up with innovative policies to help us. We will continue to do our best from this end. But we also need the demand side to give us feedback, ensure that early enough communities are involved. Don't vandalize our health facilities. Don't make the place insecure for our healthcare workers. Because, if they can't go to work, if they are afraid, then how do you get access to quality? So these are the things we think that communities and law enforcement and everyone can help with to ensure that the system really works perfectly and of course makes River State the destination to be if you have a health.
And to be proud of. All right, thank you so much, Dr. Vetty Agala. Thank you so much for this wonderful 45 minutes discussion on the health issues and schemes in River State in Nigeria. This is the Clevenard.com, and if you've not signed up with us, please do so on www.clevenard.com. Let's get to hear what you have to solve in Nigeria. Let's get to see your talent. Let's get to help you showcase everything good and perfect about the country, Nigeria. And then collectively, we'll end up building a country where each and every one of us will be safe and we will be proud of. My name is Frank Khalid. Thank you so much, and do have a blessed afternoon.